I want to congratulate you and We the World on the 20th anniversary of 11 days of global unity. Together, you, me, and we can create a better world and have fun doing it.
Thank you, Dr. Jane Goodell, for helping We the World and all our partners to celebrate over 20 years of 11 days of global unity. And thank you for joining us. Welcome to the 11 Days of Global Unity Summit, featuring visionary leaders and activists, profound dialogues, and bold calls to action. We are promoting the hashtag urgency for action. That's urgency, the number 4, and then action, hashtag urgency for action. We are using that in all our activities. My name is Birgit Ben-Eli, and I'm the Director of Strategic Engagement and International Outreach for We the World. Today, I'm excited that we will be joined by Kathryn Davis and our special guest speakers, who will be talking about the theme health for the 11 Days of Global Unity. For the full 11 Days Summit schedule, you can register for free by going to 11daysofglobalunity.org. 11 is a numeral and 11daysofglobalunity.org. There you can see all the 11 Days Summit broadcasts. And at we.net, you can take action with the 11 campaigns for change, subscribe to Trans Magazine, and you can make a contribution to support all this work by going to we.net/donate. Thank you so much. Before we bring on our extraordinary speakers, I want to acknowledge some of our amazing partners who we support and collaborate with during 11 Days of Global Unity and all year round. The UN International Day of Peace NGO Committee, Peace Day Philly, the Unite for Peace Coalition, which includes Unity Earth, the Sign Network, One World Rising Global Powwow, We Rise as One, Hubcast Media, The Awakening World, We the World, also Climate Week, the Deep and Rapid Transformation Convergence, Good News Broadcast Pause the World for Peace in Times Square, and Pace Bene Nonviolence Campaign. What an amazing movement representing literally millions of people working to achieve global unity, all working with We the World and the We campaign at we.net. Now let's bring in our host, Rick Ulfik. Rick Ulfik is the founder of We the World at we.net and the co-creator of 11 Days of Global Unity. Welcome to the broadcast, Rick Ulfik.
Thank you, Birgit, and thank you all so much for joining us. Welcome to the 11 Days of Global Unity Summit. Our summit panels are on each of the 11 summit themes, which range from unity to environment to health to human rights, freedom, and peace. Unfortunately, we are living in a time when in the USA, there has been an erosion of the rule of law, civil rights, and even human rights, democracy, and freedom, which is harming millions of people in the US and worldwide. We see powerful special interests expanding a culture of us versus them and intolerance to gain and hold onto political power. This has meant that the richest people in our society are actually becoming richer at the expense of everyone's health and well-being. Public services in all sectors like education, environmental protection, Social Security, Medicare, and Medicaid are being cut. And around the world, the results of this defunding have been catastrophic. For example, Professor Dr. Brooke Nichols of the Boston University School of Public Health estimates that funding cuts to the agency USAID since January have already caused more than 330,000 deaths worldwide. Many of these people were living in poverty and then were denied access to the food and medicine that they needed to survive. What can we do about all this? Well, I have a call to action. It's called the We Power Campaign. It's about the power of we. Millions of us coming together to transform our society so it prioritizes the common good. To help us launch the We Power campaign, please go to we.net/We Power campaign. That's we.net/We Power campaign. Now I'm really excited to bring Kathryn Davis into the conversation to talk about health and wellness.
Kathryn Davis is the host and producer of the Heart of Mind radio program since 2000, heard on WBAI Pacifica Network 99.5 FM in New York at WBAI.org. She's a Qigong teacher, energy healing practitioner, and facilitator of mind-body relaxation techniques. Kathryn has been a health activist since the mid-70s. She can be reached by email at heartofmindradio@gmail.com. Her website is daoqigonglife.com. daoqigonglife.com. Thank you so much.
Yeah, that's D as in David, AOQIGON as in Nathan, G life.com. Just to, and maybe you want to give that yourself, Kathryn, later. And Kathryn has been a longtime friend, partner of We the World, as well as a frequent participant in 11 Days of Global Unity. And Kathryn has been a leader of We the World's health campaign for more than a decade. So Kathryn, could you please give the context for your discussion about personal health and wellness? And welcome to the broadcast, Kathryn Davis.
Well, thank you very much. I very much appreciate being here, as much as I have appreciated the work of the We.net organization. And I have, over the years, collaborated with many people across not just the country, but the world, who are engaged in these campaigns. And I feel that they are all interconnected and interdependent. So from my vantage point, I approach health from the perspective of being a woman, a Black woman, but also from having a history of dealing with illness from the perspective of being living in a state of poverty, like many people in this country do, growing up as a child. And my mother had been diagnosed with multiple sclerosis. At the time, there were no remedies, and I became her caretaker at a very young age. And I saw the progression of illness and the impact on the person, the family, the community. But I also saw how difficult it was to gain access to resources because the education wasn't there, and many of the scientific research that we have now didn't exist then. But the state still exists, that there are many more advanced healing research, as well as medications, as well as different kind of equipment and different kinds of surgery that impact very strongly to people who don't have access to the kind of primary health care that they need. And in the current climate, with the rollback on funding to a lot of healthcare needs, a lot of people are going to be falling between the cracks. So I have been really looking at the health campaign, as I perceive it, as I'm working on it, as a measure of self-empowerment. It's to empower ourselves by understanding what the various components of health is, and we're going to go through that, and also to provide access, resources, and to help people learn how to advocate for themselves. And part of this campaign that I'm working on is based on really building a core of advocates, as well as not just advocates in terms of the political seen, but advocates for the elderly. We all have people in our family, people in our communities, or it might be children who need services and are not getting it, or there may be people in your area of life that are going hungry or need medical care and don't know how to navigate the new system to get that medical care. So my thought is that if we can begin to bring people to the table who are willing to serve as advocates for people in need, then that would be very, very helpful. And one of the ways I'm looking at doing that is to begin to review what's happening on the state level. So at the moment, I can look at what's happening in New York State, but what I hope to happen is for people who are doing this kind of work throughout the country in different states would collaborate and bring resources so that we can have a central access point for people to be able to find where they have to go for help and to get access assistance if they need it. So, you know, the elderly, the homeless, children are extremely vulnerable. And there's a lot of people out of work that if they don't take care of themselves, can easily fall into illness. So it's a general basket of allowing us to begin to move into lifestyles that would help us preserve our health, find support within the communities or provide support, and to know how to navigate the government and the guidelines in your particular region. So we need a crew of people to help us establish that. And I currently have someone who's an activist in her own right, contacting with the office in New York of Liz Kruger, Senator Liz Kruger. And she has a lot of information for New Yorkers on how to access health care. So I'm hoping to put together a database for all the states so that they can find out what they need to do and find out if their state is actually doing something to benefit them or to assist, and how to advocate for that as well on that arena. I have a history of being a health activist. I used to be part of Citizens for Health a long time ago, maybe it was the 80s or 90s. And in New York State, doctors were losing their license and people were being denied access to they were trying to make vitamins and nutrients only accessible by prescription. So I was part of a movement to bring protective legislation to New York. It was called the Dietary Supplement Health and Education Act, and it protected doctors who had a broader perspective on health. And it also codified and grandfathered in all of the natural supplements that come from our cultures, that come from maybe the Southern culture or the Indian culture or whatever culture it might be, whatever those remedies and herbs that have been in the world for generations, for thousands of years, would be protected and not be forced into a pharmaceutical classification. So, but that took a lot of advocacy. It meant that people had to take action collectively. So while on the one hand, I want to help people to be active in their own well-being, I want them to be able to have access to what's available to them, but also to be able to collectively advocate on behalf of the citizens of our particular states and our world. And I'm going to share a document that will give an overview of this campaign as I perceive it. And so I titled this Health Campaign at we.net. But understand, each of these campaigns is a collaboration of many people coming together to bring their resources, their intellect, their capabilities to build systems that will be able to help everyone. So the theme of this particular focus is building a better, healthier future for ourselves, our families, our communities, and our world. And the We Health campaign for integrative, interdependent, and holistic perspectives, which is my vantage point. And it's about self-care, healthy lifestyles, but looking at peer review research. And we're focusing on integrating the 8 dimensions of wellness, and they are emotional, financial, and physical, environmental and occupational, intellectual and social, and spiritual. So when we look at these 8 dimensions, we can approach our health from any of these dimensions. And as we do that, we can begin to understand the ties to our personal situation. And we're looking to offer self-learning tools, videos, live talks, and Q&A, counsel, and coaching. And we want to deepen our understanding to understand symptoms and signs of what we may be experiencing. But it's also important to build that strategy for emergency care and emergency holistic care. A big part of this is to reach out for help when needed. Too many people suffer in silence, and we want to create a culture of mutual support. And so we're a place where people will take up the role in their community to maybe adopt a senior in their neighborhood, join existing support groups if you need support, and sustain a connection with the We campaign at we.net. And as I said, I look at a holistic approach to wellness, not only in the sense of it being holistic modalities, but holistic in approaching ourselves as a fully rounded human being that includes the state of our mental, emotional, and spiritual. And that includes the internal motivation for healthy living and an integration of the multiple perspectives, as I described: emotional wellness, physical wellness. So we have to engage in living, spiritual wellness, social wellness. We have to connect deep within ourselves and also with our society. Intellectual or mental wellness. We have a really big swell in mental illness, and we have to face that. There's financial wellness, environment and occupational wellness, and I might add political wellness. And so it just offers, we want to explore different kinds of modalities, different kinds of practices based on actual studies that show benefits, and merge the 8 dimensions with the 11 campaigns for global unity. So, for example, one of my guests is going to be talking to us about that holistic help of taking care of ourselves, and that will be Janice Saunders, and she's going to be talking about integrating our health capacity. And I'm going to be doing a review of the older adult roundtable on federal cuts, providing a lot of resources for people to be able to connect and get information. And I'm hoping to bring into that mix that crew of volunteers, those people who are inspired to get involved. And this would include health practitioners, lawyers, and advocates, people who are just regular people like me and you who want to do what's right for people in our world. And so that's pretty much what the presentation will be. There may be some other things depending on time, but the idea is to understand that this is a first step. And I want people to stay engaged with the health campaign and with the We campaigns in general so that we can progress. And it is true that we have to build as a family, as a community, as a village, and support each other as we rise into a new dawn with regard to healthcare. It's really an honor to be working with We the World and the 11 Days of Global Unity. It's also an honor to introduce my guest, Janice Saunders. Janice is an award-winning salesperson and creator of the Seasonal Healthy Habits Collective. In her 30-plus year career, Janice is known for her unparalleled enthusiasm for life, teaching people to motivate themselves from within and helping them to develop superior systems to live the life they desire. Janice, born and raised in the Bronx, was also an award-winning high school swimmer turned Howard University graduate who integrates her experiences as a college athlete into the work that she does. And coming up this September 18th is the start of her program, Fall into Wellness, Seasonal Sisters 5-Day Wellness Challenge. Janice Saunders is the host and creator of the Seasonal Sisters podcast, Black Women's Wellness, Inspiring Mental, Physical, and Social Health. And you can find out more about all of this at yourseasonalsister.com. Seasonal Sisters is the go-to podcast for professional women of color, balancing ambitious life goals with prioritizing their health. This show explores mental, physical, and social wellness through actionable tips on seasonal eating, mindfulness, and habit building. Boost your confidence, improve your energy, and align your health with your purpose, all while embracing the vibrant social life you deserve. Whether you seek strategies, inspiration, or a supportive community, each episode empowers your journey to a healthier, more vibrant life. The online broadcast, Seasonal Sister Podcast. And I, as a health practitioner myself and as a vibrant, active member of this community at We the World, I'm also have been a producer of programming on health and wellness on WBAI Radio and the Progressive Radio Network. So this represents a part of a commitment that is longstanding and really quite broad. The idea here is to really focus in and learn from each community what they are doing, learn from each community what is possible. And this is the first of many in which we'll be sharing from different cultures, different understandings, and different systems with regard to health. Stay tuned. The theme of this program is really how we as individuals navigate our own health and well-being. And this is because even though there's a lot of stuff out there that we can choose from, if we don't have the motivation to get up and do it or to pursue it, it's not going to be very helpful to just have information. And that's why I'm excited about what you're doing, because you're actually shepherding people through a process where they can uplift themselves.
That's true, Kathy. And that whole process right there is the reason that I created the Black Women's Wellness Seasonal Sisters podcast. That is a big thrust of what I'm doing right now, because women do need to be inspired to be a little healthier each day. And I'm not clear that women realize the risk of not being healthy when they're, eating, not exercising, not saying no, isolating socially. These are activities that do not equal longevity. And I'm about women living long, healthy, vibrant lives. And you're right, I have been in the pharmaceutical industry for a very long time. And that, from the moment I got into that industry, I realized that, I may be able to be in this industry, but my life has got to be adjacent to this in helping women to be inspired to be more healthy. And I think that's where my gift is, in communication, in inspiring women. And the podcast is featuring women who we can all identify with, working women who are navigating their own health challenges, raising children, children going off to college, caring for elderly parents, parents passing away, spouses becoming ill. How do we maintain our physical, mental, and social wellness during that time? It is very important because we can go down if we're not careful very easily and very quickly. So
That is so true.
yeah,
Mhm.
I mean, and Qigong is a practice that my mother introduced me to. And I find that I always go back to breathing techniques that I learned in Qigong, walking meditations that I learned in Qigong. And those are things that ground me. And I'm the type of person that when I get information, I cannot hold on to it. I want other people to know that information. And right now, we're in an age where sharing information can turn into gobbledygook because there's a lot of people out here sharing information. I mean, I almost feel like women, we don't even need any more information. We know the information already. And we're overwhelmed and stuck from all of that information too.
Mm.
And then there's so much we don't know what to do. We're indecisive about what the next step should be. And it's hurting us. It's
Mhm.
hurting us in every level. So we can't bring our best to parenting. We can't bring our best to our parents. We can't bring our best to whatever work that we're trying to make in the world, whatever causes we're trying to impact. We're stalled
Mhm.
because we're not as healthy in our body and our mind and socially as we can be. And that's what the Fall into Wellness 5-day challenge is all about.
Fall into Wellness 5-day challenge. And we're going to talk a little bit more about that. I think that's very exciting. And I'm very excited about doing what I can to open up a window to all of us who are really in the trenches doing this work, because it doesn't happen by accident. And I also wanted to comment on your targeting your work towards Black women, because I feel that Black women have the most negative health outcomes in this system. More Black women are dying in childbirth. More Black women are having difficulties with that childbirth process. And then when I look at my own family and I look at people even in my age group and younger, they're all sick. They have diabetes, they have hypertension, they have all of these diseases that are related to the stress we live under and the poor decisions that we use to cope with that stress. So I think it's really, really important that you are focusing on the real core demographic need, and plus, the heartfelt being part of that demographic as well, and seeing the destruction in our families and our friends. And I just want to mention for the wider audience that as we help our own communities build and get stronger, the same principles apply to everyone. I recognize that this is where the most need is across our nation, across the world. Black women have been holding things up since the beginning of time. And so much comes, all of that stress we're inheriting. So even if we are doing the right thing, we're inheriting a lot of that. It's coming through the DNA. And we have to be very purposeful to begin to heal those inner rifts and move in a direction that's going to help us heal. And I'm wondering if you could give people a bit of an example of how what you're teaching, how what you learned through all these things you're doing in your life, how you've applied them to your own life in order to keep yourself vibrant and healthy.
I have to second everything you said. You know, what one of the things that has driven me in the last number of years is that a young friend of mine had a stroke when she was 47, I believe.
Mm.
And in speaking with her after she had the stroke and the difficulty that she was having speaking, she really had been impacted by this stroke. It took me, and once she got everything out that she wanted to say, the bottom line is reduce stress.
Mm.
That was the bottom line to her. To me, she was, don't hold on to it. Reduce stress and listen to your body. So what did I do? I had been at this time dealing with fibroids for a number of years, and I was afraid, absolutely afraid of having surgery because of the potential of being addicted to opioids after the surgery, which is a very real concept that happens to people post major surgeries like this. I had seen opioids tear people down, but the stress of not having that surgery was starting to get to me. It was
Mhm.
impacting every part of my life. And she said, stop. You're going to have to figure out how to do this. So again, I worked with my healthcare provider, planned for the surgery, and it just so happened that I ended up going to NYU and they had a protocol that reduced opioid use post-surgery. So that was like, that was the window that opened up for me. And it allowed me to, okay, I can do this. You know, I can do this on my terms now. And it opened up a whole nother world of health for me. I
Mhm.
wasn't unhealthy before, but my mind was so focused on the stress of not being able to have this surgery that I couldn't even think about anything else. I
Mm.
was doing parenting, I was doing coaching, I was doing speaking skills, I was writing, I was doing all of these things, working at a high level, even in my state of not feeling well. Once I decided to have the surgery and actually fit it into my life, I felt so much better. I had become pre-diabetic. My heart was not damaged, but I wasn't getting enough blood to it because I was losing blood,
Mm.
so much because of the fibroids. So all of those things concerned me. I couldn't exercise as much as I used to because I just didn't have any energy left. I couldn't sustain that. And having the surgery reduced a major amount of stress for me. I was able to kind of get back into very slowly into what I thought a healthy lifestyle could be. And, you know, moving my body a little bit more, paying attention to how I managed my stress, working with my breathing, working with my movement, working with those two things in concert together to kind of get the energy flowing in my body again in the right way.
Mhm.
So, and in the end, just to round the story out, on the podcast, I did interview my friend who had this stroke. I can't remember what episode it is, but it's on there. It's probably from about a year and a half ago. And you know, it's just one of those, it was a full circle moment where we could share about how something so devastating for her made an impact on me, changed my behavior, And then together we can talk about it, and hopefully that can impact other women and the decisions that we're making every day to manage our lives. So that's just one example.
That's really a really good example because it touches on so many bases in terms of that. Because first of all, we want women to not be having that stroke in the first place.
Yes.
And but also the capacity to come together and build each other up and help to support each other in our process is a really important part of it. And before getting to your program, can you speak to, because this is something that I have found a lot of people in the complementary alternative health field are too narrow in that space. And they don't recognize that there are times when they absolutely must go to conventional medicine, allopathic medicine, emergency surgeries, all kinds of things. Medicine can be very, very good and is very good. What it's not good at is helping you to stay healthy, get healthy, and live your life in a healthy lifestyle. But you do need to pay attention to both. And I'm wondering if you could speak to that.
That is, you couldn't be more clear, Kathy. In life, we need to use the modalities that are available to us. Modern science wasn't developed for nothing.
Mm-hmm.
Modern science helps us when we have a problem. You know what I mean? If you
Mm-hmm.
walk in the door and your blood pressure is 220 over 110, your doctor is going to call 911 and they're going to come get you and they're going to hospitalize you.
Mm-hmm.
And they're going to put you on medication to lower your blood pressure. You go in to the doctor and they test you for diabetes. They take a test for you, and you have a sugar that's 13 or 15 or 17, your hemoglobin A1C. They're going to stop you. People are going to be calling you every 5 minutes to get you to come back so they can start you on medication. Because these are things that are known to cause big problems for you,
Mm-hmm.
problems. And that's where medicine can be effective, very effective. You have a problem like that, you want medicine to come in and be effective. The alternative strategies that, and people don't want to use medication. I get that. And then if you don't want to use medication, then you've got to use a lot of other modalities to affect change in your body. You've got to be pulling every lever that you can in every decision that you make from the time you wake up to the time you go to bed so that you stay out of the zone where you're going to need medication. What do you have to do? You got to be working on your eating habits. You've got to be working on your rest. You've got to be working hydrating yourself. You got to be making sure that you're taking care of your skin. You've got to do all of these things, your stress levels, all of these things, so that you can stay on this side. And let's be real, 1 in 9 people get cancer. 1 in 3 women have cardiovascular disease. So the chances of not having a problem are very low. We're going to have something as we age. And aging in general is a risk factor for having some type of problem.
Yeah.
So the if you are blessed, with aging, maybe you might have high blood pressure. Maybe you might have arthritis. Maybe you might have high cholesterol. Maybe or maybe not. But the point is, aging leads us to our body changing, and you may need a pharmaceutical intervention.
Mm-hmm.
And we've got to be open to doing those things, and at the same time, pulling all of the levers that we can to be as healthy as we can.
Mm-hmm. Mm-hmm. And I think part of that conversation is also if you end up in the hospital. I know someone who ended up that very situation.
Mhm.
The doctor said their blood pressure was too high. They got whisked off to the hospital. She was in hospital for a couple of weeks. They gave her medication. I don't know what it is. but the medication itself, she had a bad reaction to. And I felt that that was where the hospital kind of was not responsible. They sent her home, but they sent her home in a state where her limbs were huge, swollen, and full of fluid, which to me said there was something going on with the kidneys, which may have been an allergic reaction to the medication she was taking. And so I think that as we're interfacing with the healthcare system, we have to understand that a lot of these treatments, medications are kind of generic to the baseline. And we have to pay attention to our individual bodies to say, wait a minute, you cannot give me this medication. You have to find something else. I'm having a reaction to it.
Absolutely, because
And
there are a plethora of medications. And
yeah,
that's one thing I want to make sure that people understand is that the outside of the relationship and conversations that you have with yourself about how you're going to care for yourself, you have to be on a bridge with your healthcare provider. Your healthcare provider can't care for you if you're not telling your healthcare provider what you're doing. If you're telling your healthcare provider a fantasy of what you're doing, that person cannot be on a bridge with you to
mm,
provide you with the proper care. So it's
mm,
a difference in how the healthcare provider can be in conversation with you, but those are little bits of shame that are in our health that we all have. You know,
mhm.
I just ate a donut. Oh, well, I shouldn't have done that. You know, there's a lot of shame in things that are around health. Do I drink? Do I eat fried food? Do I eat sweets? Do I eat this? Listen, all of that is open to you. And you can do a lot of things to be healthy and be able to enjoy life at the same time. I think that's the misconception that people have a lot of times is that they can't enjoy life if they're being healthy at the same time. Forget it. Nobody's going to invite me to brunch, you
Mhm.
know. But this is not true. I want women, all women, to understand that you can be healthy and enjoy life.
I love that. You can be healthy and enjoy life. You need to put that on a t-shirt.
Heard it here.
And I feel I'm so much resonating with what you're saying, but I understand that there are a lot of issues where people don't have a healthy interface with the care system, not because of their own um not being coming forward, but because the space of the healthcare system has become very remote. A lot of it's through technology, and people need help with technology. And
Yeah.
a lot of the interfacing people who work at the front desk are themselves so stressed out that they're not in a position, or they don't find themselves in a position to be able to listen, to have compassion. So there's a lot of moving parts. So I would think that as we go into, you have to navigate emotionally, you have to navigate in terms of your state of mind, and connect with healthcare providers on a level that allows them to relax a bit into their compassionate space. I think as we approach each other as human beings, we have to understand that we all have the same vulnerabilities.
Yes.
Where we meet someone can make a big difference in how that whole process goes through. And the other thing I wanted you to touch on is I lost my full-time alleged 9 to 5 job. The fact that I worked till midnight is another story. But that job situation ended. But it was another 10 years before I reached a point of Medicaid.
Mhm.
And so I was still working, making a little bit of money, but not having enough. But I didn't have the economic resources to integrate into the healthcare system, because people, it's a lot of money if you don't have that coverage. And
Mhm.
because coverage is most often linked to jobs, there are hordes of people who just don't have that at their fingertips.
Mhm.
But in that situation, I think it's important first for what you were saying to understand when it's enough of an emergency that you need to take yourself to an emergency room. But there are things that you can begin to recognize in your health and things you can do. And I'm wondering if you could speak to that, because I think as people join you in your project, Seasonal Sisters.
Seasonal Sisters will be beginning the Fall into Wellness 5-day challenge 18th. And I think what you're saying is very important. Yes, healthcare is very complicated, the systems of healthcare. And having healthcare is very important. One of the things that I think people can do if they find themselves in a situation like this is make sure you have access to a primary care provider. In New York City, there are a lot of resources that aren't available nationwide. And I think that everyone in New York City probably has access to a healthcare provider. It may not be, what someone else might have who is paying for their insurance and all these other things because we think everything is equal and we know that it is not. And that is one of the hard truths about healthcare. And if we have things that we can do each day that we are in control of, I think that having routines, things that are on our list, no matter when we get to them in a day, is really important. I would say to have a couple of things in each one of these categories. As far as your mental health is concerned, maybe if you can take a walk, you can sit quietly for a minute, maybe have time to write a few things that you're grateful for. Hitting those two things for your mental health anytime during a day will keep it so that you have a practice. Then if you're thinking about your physical health, maybe the walk kind of helps with the mental and the physical, but maybe you want to add a piece of fruit because we're always talking about, oh, something has to be so grand. It has to be organic. It has to be this. It has to be that. It can be a piece of fruit. Social wellness. Don't isolate alone. Call a friend. Get on, go to the library, strike up a conversation with a stranger. And there's data on striking up conversations with strangers and how that makes people feel better. You feel it improves your mood and it increases your social contacts. Everybody doesn't have money to go to the, Starbucks every day and have a conversation with the barista. That's going to cost you $7. You know what I'm saying? But that conversation in the library can be free. It brings the same type of social interaction that conversation that the barista might have. So you want to be hitting things that interface with your mental health each day and having that gratitude practice, maybe taking a walk, your physical health, choosing a piece of fruit or choosing to walk or march in place at home, whatever it is that you're going to do with that, and then having a social practice, where you're connecting with people on a regular basis. If you've got a friend, call them. If you have a friend you haven't spoken to in a while, call them. They probably want to hear from you. We have such a negativity bias in our lives. Oh, they don't want to hear from me. I don't really have anything positive to say. I phoned a friend once and she said, you know what? I am so glad to hear your voice. I haven't heard it in too long. So no, we don't know what people are going to say to us when we call. Feel good about that.
It makes me think about your program, Seasonal Sisters event, that's that friend in a manner of speaking for people who want that interaction and that encouragement. So tell us a little bit more about the event that's coming up.
Well, we start on September 18th, and it's the Fall into Wellness 5-day challenge. I'm into using the energy of the season for a fresh start. What you did in the summer is not what you're going to do in the fall. The weather changes. The fruits and foods that are available change. And our bodies are craving different things at different times. So it's really an opportunity to slow down, take in less mentally, take in less physically, do less socially, be a little bit more intentional and reflective for 5 days.
Mhm.
And that is really what we do. And I use body astrology just because it's a fun thing, it's a fun tool that gets people to think about their body. I mean, we never think about our body. I mean, who's thinking about their hands and arms? Nobody. Who's thinking about their neck? Nobody. Who's thinking about their back? Many people have back pain, so I'm going to say that people think about their back a little bit more. But in the fall, we have Libra, Scorpio, and Sagittarius. So we'll be talking a little bit about the regions of the body that correspond to those areas and how to keep them strong and healthy. That's really literally the lower back, the sacral pelvic region, and then the hips and thighs. So that is where and it kind of connects the upper part of the body to the lower part of the body. And we'll be talking a little bit about that. But I'm not an astrologer. I use metaphors. What are these parts of the body doing for us? And how do they feel? Do they feel healthy? And we know if our body feels healthy or not. We know if our legs hurt. Yes, we do. We know if we have pain in our lower back. So we're going to be talking about those things and how to integrate and experiment with tools that help us to be a little healthier each day.
Wow. That's really wonderful. 5-day focus on the wellness of ourselves, really. So that's pretty amazing. And how do people connect with you for that? I know you have a website, I believe. I see it as yourseasonalsister.com.
Yep.
Is your event going to be on Zoom or virtual in a real place?
Well, I wish it was in a real place, but Zoom helps us to connect over the 5 days. So there'll be 3 live sessions, and then you have 2 sessions to kind of relax and integrate and do some things on your own. And we come back, we talk, we have more teaching and coaching and learning going on. But it is on Zoom, it is virtual. So we have room still for a few people.
And you also, I understand, do private coaching.
Yes, in the season, there is the opportunity for a private coaching. Yep, I have a group that'll be starting probably on the first new moon of the fall, which is called Inspirational Wellness Manifestation. It's about manifesting wellness. One thing about health and wellness that is tough is it doesn't take overnight. Sometimes a lot more is needed.
Mm-hmm.
Get you moving, to get to get clarity on what it really means to you to be healthy. Because some of those things are the reasons, are the real fire that light people up to help them to take that next step to actually taking action.
Excellent. And where can people find your podcast?
Podcast, Black Women's Wellness, the Seasonal Sisters podcast. It's on Apple and Spotify and probably a couple of other things too, but those are the big ones.
Okay.
I want to thank you, Kathy, for including me and thinking of me and the message that I am trying to share with women, which is very adjacent to the message that you've been sharing all these years, is that it takes a village for us to prioritize health and learn modalities to be healthy. So I'm happy to be a part of it.
I'm grateful as well, and thank you. And I have to think that, focusing on women means you're focusing on the family, means you're focusing on the children in their lives, you're focusing on their partners. So it's like an open portal into the whole community when you focus with women at the start. That's my understanding. So thank you so much for the work that you're doing, and thank you for joining me today.
Thank you, Kathy. Have a great day.
Thank you. You too. Bye-bye now. I want to thank you for listening to our interview. And now I just wanted to do a brief informational update with regard to access for healthcare. And part of our goal here is to begin to weave together the various government services and volunteer services that people can access in their home districts. Now, I, living in New York, are looking to see what's happening here in this region. And our hope is that those of you who are activists in other regions who are working towards honoring that healthcare as a human right, and are working to make that so, we can begin to congregate and interface and collaborate on ways to bring proper care and proper services to all of our communities throughout the country. So that's my goal. And I'm going to highlight as an example of this what's going on with our state senator, Liz Kruger's event, Older Adult Roundtable on Federal Cuts.
Good afternoon, everyone. Hi, I'm Liz Kruger. I'm the state senator from the 28th district, and welcome to this webinar, whether or not you live in my district. I would like to welcome program attendees who are viewing this event on Zoom and or Facebook, or who are calling into the first session of our 2025 virtual older adult roundtable series on the impact of federal funding cuts on older adults. This afternoon's beginning program is titled, We Can Fight Back. Learn how to advocate for what we need.
You'll find the link for this event in the description. I found it to be very informative because it gave many resources and helped us to realize what bills are in the pipeline and what needs to be done in order to advocate for older adults in the New York City region. But I believe every state, every city must be working on these kind of things. I'm just going to give you a sense of the resources that were shared, and I do encourage you to watch the video. This is the NCOA's Action Center. Advocate for all to age well by adding your voice to protect and strengthen the policies and programs we all depend on as we age. NCOA.org. U.S. Aging advocates for the policies and resources that allows its members to provide the choices older adults, caregivers, and people with disabilities need to lead meaningful lives. That's usaging.org. Justice in Aging. Receive regular invitations to Justice in Aging training sessions and webinars. Be the first to read new policy issue briefs. Stay informed about the latest litigation developments and keep up to date on news and policy changes that impact your work and clients. And that is justiceinaging.org. Provisions on immigrants' access to public benefits in the Financial Reconciliation Package, updated September 2025. And that was a document, so you'll find the link to that document in the description. The idea is that every city, every state, and on the federal level, there are people, agencies, activists working in order to bring back coherent, compassionate healthcare. And we hope to hear at the health campaign of we.net is to begin to bring all this information together in a space where people can come together, discuss, get support locally, and collaborate nationally to bring about the state where healthcare is and remains a human right.
And now Birgit is with us as well. So thank you so much for this really inspiring and informative discussion.
And thank you. I appreciate all that you do, both of you. Birgit
Thank you,
and
Kathryn.
thank you for all your
And
service.
we appreciate you very much. And the work is so important you're doing, Kathryn.
It really is.
Nowadays, more than ever.
Thank you.
And thank all of you who are watching this and for being part of 11 Days of Global Unity. To get involved, please go to we.net, and you see what I'm doing, the three fingers. It's all about we, right? So this, for people who don't know, this is a W. So let's go from a me society, which is an M, to a we society. And that's why we launched we.net. So together we can create a world that works for all. Thank you so much.